Hello, my name is Dr. Dewan S. Raja. Today I will discuss about echinococcosis, also called hydatid disease. Echinococcosis is caused by the larval stage of a small tapeworm, a cystode. The eggs are passed through the feces of dogs and other canine. From those eggs, larva is produced, and that larva forms the echinococcosis. Transmission through oral contact with contaminated dog feces or through contaminated food, fruit, or water. Canine means not only dog, also the fox, wolf are also passing the eggs that will turn into larval stage in human and also in sheep. And the dog and the canines are the definitive host. Sheep or cattle or accidentally human are the intermediate host. Transmission, oral contact with contaminated dog feces or through contaminated food or water. Echinococcus granulosus is prevalent in many parts of the world, including Asia, Europe, Oceania, including New Zealand, Australia, and both North and South America. We have another type of Echinococcus, that is Echinococcus multilocularis, is endemic in Central Europe, parts of Near East, Russia, Central Asian Republic. Near East means the area between Caspian Sea, Mediterranean Sea, and the Gulf of Persia, that include Turkey, Iran, Azerbaijan, or Armenia. Okay, Central Asian republics indicates the previous Soviet Union regions in the Central Asia like Uzbekistan, Kazakhstan, or Turkmenistan, like that. China, Japan, Canada, and Alaska will get Echinococcus multilocularis. Echinococcus vogeli and Echinococcus oligarthus in tropical, central, and northern South America. So these are the epidemiology and type. And this is the mode of transmission, oral contact. And causative agent is Echinococcus granulosus, Echinococcus multilocularis, Echinococcus vogeli, Echinococcus oligarthus. This is the most common type, commonly called dog tapeworm. Okay, we got that. Now if we go to the life cycle, this is taken from CDC through its part DPDX. Okay, this is most common, cystic echinococcosis. We will get cyst formation. Cyst means cavity containing fluid. Okay, so this is maybe a few millimeter, maybe several centimeters. Okay, may contain even liters of fluid in certain type of echinococcosis. Okay, we got that. So this is the definitive host, this is the intermediate host. Human are aberrant or accidental intermediate host. So its intestine contains the adult Echinococcus granulosus. Okay, its intestine, and this is the gravate part, and this part contains the egg. The embryonic egg is passed in the feces. Somehow it enters the mouth of the human. Okay, maybe child, maybe person fond of the dog. Dog go outside, and dog may eat the carcasses of the sheep. Okay, so the patient gets the embryonic egg in the feces that is going to the mouth, and it is coming to the intestine, especially the duodenum, and it will be oncospore rhesus out that penetrate the intestinal wall, and that go to the liver by means of the portal circulation. Okay, then This is the most common site of hydatid cyst formation, liver, most common site. Then from the portal circulation, it may go to the different part of the body to the lung. This one lung, this is another lung. It may go to the brain, go to the spleen, may go to the kidney, may go to the bone. Okay, even it may go to the eye, or it may go to the muscle. Okay, so that is that oncospore hatches, penetrate the intestinal wall, and it will be converted into hydatid cyst. Hydatid cyst has outer pericyst, then ectocyst, then endocyst. That is the germinal layer. We'll get the brood capsule, we'll get the daughter cyst, and we'll get some free protoscolex. We call it the hydatid sand. The hydatid sand. This germinal layer secretes some fluid here. There is amorphous substance and fluid here. Okay, so this is the protocolex from the cyst. Okay, so that will convert it into scolex that will attach to the intestine, and it will again pass out the embryonic egg in the feces. The dog eat the carcasses of the liver of the liver of the sheep, and the dog ingests the hydatid cyst. Okay, and it ingests it, then this will be the protoscolex. It will be converted into scolex, and it is attaching part that will attach to the intestine. It will be grow up, and it will have this is a gravid component that will release the egg. Okay, so this is the definitive host. Maybe the other, like wolf, maybe the fox. Okay, here is the alveolar echinococcosis. Alveolar means here we have one cyst, it become large, and we have some brood capsule with the daughter cyst. Okay, here there will be another cyst, like alveolar growth here. That is called alveolar echinococcosis. This is not more common in the lung. The cyst will be again mostly in the liver, then lung, then the spleen, brain, then the bone, maybe the muscle, maybe the kidney. Okay, its growth is not like within one cyst, but with multiple cysts, and they are separated very quickly, forming alveolar, like malignant cell-like growth. Okay, and that is more devastating, even more devastating than that of cystic echinococcosis. Alveolar echinococcosis grow faster. Okay, and the definitive host may be dog, but this is the most commonly the red fox definitive host. Intermediate host is the rodent, like a rat, maybe squirrel. Okay, this is that. Again, the fox eat the rat or the squirrel and get the cyst. This is alveolar hydatid cyst, and will dog in the intestine. There will be release of the protoscolex. That will be scolex. That will be matured into this part. Okay, and this part is the gravid part. There will be release of the embryonic egg feces, and that somehow enter the mouth of that water from the stream or some fruit on the ground, like some berry, and without washing that or without taking the outer shell of some fruit, people may eat it, and people may get this. Okay, so then cycle is like that. Okay, clinical features of echinococcosis. It may be asymptomatic. Clinical manifestation depend on the size and condition of the cyst. If it is in the brain, then certainly convulsion. If size is very large, abdomen will be protruded. If it is behind the eye, then eye will be proptosis. will be proptosed. And if it is in the abdomen and large cyst in the liver, there may be hypochondriac pain. And the condition of the cyst, if cyst is broken, then there may be allergic reaction, maybe anaphylaxis. There may be secondary cyst from rupture of the cyst. That is also possible. Or cyst may be calcified without causing any harm. Most common site is the liver. Other sites are lung, spleen, brain, bone, eyes, muscles, and kidneys. Cyst may be single or multiple. Multiple organ may be affected. It is not necessarily always in the liver. Maybe in the liver and the lung. Maybe in the liver, lung, and in the brain. Okay, but liver is the most common site of hydatid cyst. There may be jaundice because of obstruction of the biliary tree. Even the cyst may open into the biliary tree. Okay, dyspnea, that may happen because of cyst formation, hydatid cyst formation in the lung. Okay, and that may open the bronchus. Person may cough out the hydatid cyst fluid, and that may give some salty taste. Okay, and there may be pain depending on the size of the cyst. If it is very big size cyst, then certainly there may be hypochondriac pain over the liver, and usually the cyst develop in the right lobe of the liver. Spillage of leakage of cyst fluid can precipitate hypersensitivity reaction. There may be urticaria, itching, maybe little fever, or maybe very severe condition, anaphylaxis or death. Secondary cyst may develop from spillage. Okay, we got the image here. This is the hydatid cyst. Again, we have the pericyst, ectocyst, endocyst or germinal layer. We have the brood capsule, and we have the daughter cyst, and these are the hydatid sand, S-A-N-D, sand. Okay, so here this is that. Here there will be alveolar growth, and from fox for somehow enter the mouth. Okay, but our definitive host is the canine. It may not be always the fox. It may be wolf. It may be even dog. Okay, here definitive host is the dog, but maybe wolf, maybe the fox. Okay, we got that. Then we'll go to here, diagnosis by ultrasonography. This is the diagnostic choice: X-ray, CT scan, and MRI. ELISA test of IgG, linked ELISA test, and enzyme link transfer of antigen Bolt assay. Okay, but we have to remember that diagnostic assistance is available through CDC. CDC will help the diagnosis of the echinococcosis. And Cassoni's test, this is almost obsolete now because of the non-specificity, and it is difficult to standardize the antigen level, and we'll have a lot of false positive tests due to Cassoni's test. It was old book study, it was practiced, but it is now obsolete. Treatment: surgical treatment, but without damaging the cyst, without spilling the cyst. The choice is now pair: puncture, aspiration, injection, re-aspiration. Okay, it should be re-aspiration. Write it here. Okay, re-aspiration here. Re-aspiration. Okay, and the drug of choice is the albendazole. It is better to give two drugs, albendazole and praziquantel, for better efficacy. Ideally, medication should start 1 to 3 months prior to pair or before surgery, and they should be continued for another 6 weeks. Sometimes surgery or pair may not be possible. Suppose some cyst is in the brain or spinal cord. In that situation, this medication may be taken for couple of years with high dose. This dose is always higher than that of the usual albendazole therapy for the common nematode helminths, and it is better to consult with a tropical medicine specialist. Okay, that's all about the hydatid cyst or echinococcosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.